was my first attempt with the SCA. My story is more about sort of faith, because I had really difficult circumstances during this exam. I usually start my preparation just after booking my exams. Same thing I did with AKT, but my circumstances were different. This time I was 28-week pregnant with when I took this exam. And I also have a child who has a long-term condition for which I had to go to the hospital, and I had no idea that I would be dealing with all of this alone, because I had some situation with my husband as well. His father was unwell, so he was away. So it was difficult juggling everything in the last 4 or 5 weeks after booking the exam. I found out about Dr. Imtiyaz Academy from a friend, and I think what helped me most was how I started the preparation was making videos of myself with actual patients, and then having my ES to have a look. So I used to have this this sort of a blueprint of what I need to do, data gathering, relating to others, management, and have this pasted like in different places in my office. And then I started following this pattern and seeing patients and making a video of myself and showing them to my educational supervisor. That helped me a lot, because we are all clinicians. We have been doing this for a while. What happens is that when I used to practice with my colleagues at the regional teaching, I would get nervous. I would get so nervous that I would start laughing in between the consultation because I was trying to act it out. So the best thing I would advise is treat it as real patient. You're good with real patients. You don't have to pretend that you're acting something out. Just see them how you would see your actual patient. So when my ES gave me a good feedback on my videos, that gave me confidence that I can prepare for this exam. What I lacked was my confidence in my knowledge. So Dr. Imtiyaz, Dr. Amar's notes, they were very helpful. I had a chance to listen to a few lectures like the endocrine one and musculoskeletal, which I found very, very helpful. But unfortunately, due to my own health condition, my daughter's condition, and juggling everything, even out of hours a week before my exam, I decided I could only just quickly go through the notes. But I think that's, for me, that was more than enough. Dr. Amar has done a wonderful job of he has done a wonderful job of compiling everything. So you don't have to open book or CKS guidelines to learn everything. It's all in there. So if you have a good knowledge base from there, and so add your own consultation skills, it helps out a lot. So on the day of my exam, my father-in-law passed away, and it was a very difficult situation. I went in telling my ES that I cannot take this exam. I cannot sit for this exam. I'm not in the right state of mind. And he encouraged me that if you were not taking the exam today, you would still be working. So just treat it as a normal clinic day for yourself. Just pretend that these are real patients that you're seeing, and you'll be fine. So the first 2 patients, I remember I was not in the right state, in the right headspace. And I really was focusing that this is an exam. And that showed up on my result as well, that my first 2 stations weren't very good. I failed in data gathering and management in them. Did manage to get a clear pass in interpersonal skills, but I couldn't just focus on the data gathering. After that, I composed myself, told myself that this is another clinic day. I'm just seeing my patients, and that helped a lot. I would suggest that all those medical cases where you have to go into management, like diabetes, asthma, or urgent care, you should get into those 6 minutes or 7 minutes into the consultation. But the cases which are more complex, for instance, where the patient is more emotional, give them time. I had one station where I had only literally just 3 or 4 minutes of management. And I was really worried about it, that I did not get to spend 7 to 6 minutes managing this patient, because the patient was so upset and I had to give her time and had to be empathetic. And it turned out I got clear pass on all of those, uh, in all categories in that station. So I would say that do not try to act, because one of my friend, she must be here, she said we're not actors, so try not to act. Instead, just treat it as a normal day, but have a strong knowledge base, which will be easy because Dr. Amma has already composed and compiled everything for us. So I did not get a chance to do mock exams. I really wanted to do with Imtiyaz Academy, but I did not have the time and there was so much going on, so I could not do that. But in my last two tutorials before my exam, I did 5 stations each time with my ES. Um, and I had never seen those stations before, so I would just give him some cases, and he would pick up the cases, and we would practice, and that helped a lot as well. So yeah, so my story might not be relatable, but I think if you combine your day-to-day consultation skills and the knowledge from the notes, that worked perfectly for me.
Thanks so much.
Thank you.